Senator Begich.
Thank you very much, Madam Chair. Thank you, Dr. Rubidoux, for being here. And I apologize I wasn't able to get her right away at the beginning, so I didn't get all your opening statements. But if you recall, the last meeting we had was on the budget. You probably sensed a great frustration from me. And if you didn't, you should have. I will be honest with you that many within my state, as well as other states that I've talked to, are not satisfied with the leadership within Indian Health Service. I get the challenges you have, but I want to add to what Senator Heitkamp said, and I don't want to put words in her mouth, but I feel like at times being an advocate means truly stepping out of the box and telling people they're wrong on certain issues, and I don't get that sense. And let me just, when we had this conversation last time on contract support costs, I know there was a conversation just before as I got in here, and I asked you who came up with this proposal that I've yet to find anyone in the tribal community that likes. And you're the advocate. You're the person they turn to help protect them from this bureaucracy that honestly has shortchanged American Indians, Alaska Natives, Native Hawaiians for decades. And so if I can, I'm going to ask this again, and I'm hoping I can help me get the answer I'm looking for, I think, here, and that is, how are you going to solve this problem when you have tribes that do not agree with the administration's proposal in delivering contract support costs? How are we going to solve this? And I know you talk about tribal consultation, which I agree, but tribal consultation is it's not just having it, it's actually taking their recommendations and making it happen. How are we going to solve this problem? Because I tell you, the administration is wrong, absolutely wrong on this. And you should be saying the exact same thing because you know the tribes disagree with this. It's not a right way to do the business, and they know it. And so go ahead and comment. I'll just pause for a second, or I'll just get on a rant.
Well, Senator Begich, I understand your frustration about this, and I see the frustration in your words and in your face. And I know you're advocating for your constituents in Alaska, and I want you to know that the administration heard loud and clear the tribes don't like that proposal. Absolutely. And that's why the administration wants to consult with tribes. And, we have been consulting on contract support costs for some time. And we did know that the tribes anticipated that the tribes would not like that proposal, yet we're facing a difficult budget climate and facing other tribal priorities. Just last week, sat with a room full of tribal leaders who were talking about we need to have other tribal budget priorities be advocated for just as strongly as contract support costs. And it's my job to bring the voices of tribal leaders back to the administration and do what we can. And I can assure you that all of you were heard in this conversation leading up to the administration's decision about this. But one of the strategies, I think, is we have to take a slightly different approach. And I've been actually working with some tribal leaders who are on my advisory committees, and they recognize this difficult problem of contract support costs and funding and other budget priorities, and how do we balance all those issues. And so we're going to try some different types of meetings where we sit down and have some frank discussions about these issues. I really feel like it's an attempt to step outside the box and try to find a solution to this, because it is a challenge, and if confirmed, I'm willing to work with these tribal leaders, all our tribal leaders, really, to work on this very challenging problem.
Let me ask you on contract support services. I know what I understand is probably some from past contracts, some efforts to do some settlement negotiations. Can you very quickly, because what I keep hearing is it's slow moving. Everyone's perception slow is their perception, but again, it's like, okay, this is not complicated. Here's what's owed. Here's what's required. Here's what the courts have said. Tell me how you see the status of the settlement negotiations going at this point from your view.
Well, the Indian Health Service is committed to making the settlement of these past claims as efficient as possible, and the goal of settlement is possible. And that's why we've been working with tribes and the tribal lawyers to try to find a more efficient process to settle those claims. We don't have a class action, and so therefore we have to use our authorities under the Contract Disputes Act and through the Judgment Fund to get these settlements done. We have been listening to the tribal lawyers. We now have a case management plan that has been agreed upon with the tribal lawyers on all the cases currently under appeal. We've based on our experience so far, have now recommended 2 options to try to make the settlement more efficient and to reduce some of the paperwork that tribes had. So what I feel like is because we don't have the class action, we're sort of working on it as we go, and we are getting more efficient, and I think we are making progress. And again, it is our goal. We want to settle these past claims because we want to move forward.
Do you think your timing on settlement would be, I mean, where do you think this window is? How wide open and timetable is this window to, do you believe that you can get to a settlement? I mean, is it months? Is it years? Is it days? Is it, what do you think based on your description of what you just given me?
I'll have to go back to my lawyers and get their opinion on it, but we've actually settled our first case since post-RAMA, so a tribe is actually getting paid from the Judgment Fund for the first claim. That has helped us a lot. It's sort of like the work was really on the upfront, and I really do feel that the cases are going to start getting settled a lot quicker, especially with our option of just the administration one-time offer is a more simple approach. So I'll talk with my lawyers and
will you share that with us?
We can share that.
Okay, let me, I know I'm over my time, Madam Chair. Let me just say, I have a couple other questions. I'll just submit them, but let me, Dr. Rubido, I want to make you successful, because if you're successful, then we know our tribes will be successful. That's just the bottom line. If you're a successful leader in your position or reconfirmation for your position, but there is a lot of issues. It's not just from my state. Every state I travel to, I try to meet with tribes from the communities there. It's a responsibility of this committee, and I hear feedback, and it's frustrating to me because they look to you as their advocate, and that means not just behind closed doors, but in public, because they come to us and they vent frustration. And, you know, we don't run the government. We do policy, we do appropriations, we send you what we think. At the end of the day, you have to do the day-to-day activity. And so I would just stress upon you the great desire by all of us to see you successful, because it is having an impact. And I will just tell you, I spend too much time in my office with tribes from Alaska and outside of Alaska venting about their frustration. And honestly, as a former mayor, as a manager of a big workforce, that is not a good sign for a manager. I'm just being very blunt with you. And I have some other issues I'll share them with you later, but again, thank you for being here today.
Thank you.